questions that I think.
On the Medicare Advantage programs, which this national bill addresses, that is, my understanding, is gradually cutting back on that extra reimbursement for the Medicare Advantage programs. And slower in states that are richer that way, like New York and Florida. So it's gradually phasing that back to what everybody else in Medicare gets, is my understanding. Medicare is certainly not perfect. It has a long way to go to perfection, but talking to docs and people who have, were around before it was created, we still say that we're, patients and doctors are better off with it than without it. So I think if we were all in that same boat, we'd be pretty motivated to make sure it was a decent boat and would float. Let's see, my opinion on McKenna's Washington State lawsuit about the National Health Care Reform being unconstitutional. I say, where has he been all these years that so many people have been dying for lack of health coverage? Number one. Number two, as far as I can tell, it's just his little bid to run for state governor. I think that's what it's really about. What do the majority of physicians think about single-payer healthcare system? There have been polls, and there is increasing support. One of the biggest national groups, the American College of Physicians, which represents internal medicine docs, finally came out publicly in support of a single-payer option as one supportable option. That was a big step by the biggest group ever. The AMA, being much more conservative, of course, opposes it. They like the kind of free market reform idea. But physicians in Massachusetts, when polled, a general poll, a majority of them supported a single-payer solution, since they're seeing so much of a mess out there. So it's building. Most docs, I would say, are generally more concerned with their own income than their patients, and they will couch it in phrases of, oh, I'm just out for the best interest of my patients. Yeah. But I think that's not really true, is my take on it. Let's see, Interfaith Clinic is always prone to budget cuts, so we're working hard to tighten things up and being as efficient as we can. Chances of eliminating for-profit insurance in the U.S. and making any healthcare insurance non-profit only, I don't think that's anywhere in the foreseeable future. I think it should be, and I'd say, in Germany, they just have they have for-profit health insurance companies, but they're very tightly regulated. So much so that it's almost non-profit. It's still a profit system, but they just have very tight regulation, and they have a bunch of them, and pretty much everyone is covered there. One thing that kind of drew me towards the individual mandate for insurance is a lot of countries that have universal health insurance actually do it through an individual mandate to have insurance, but then they have a really well worked out system to actually make it affordable for everyone. Ours kind of has the mandate without the affordability part. Also, hardly any good reforms on the whole profit rip-off system of the health insurance companies. Let's see, new taxes, as it often happens, new taxes promise to provide a desirable outcome, then to be misdirected, and eventually costs continue to climb. What will happen with the health care if we start with an income tax? Well, the legislature can always change things after either they pass them or we pass them. That's the way it is. You pass a law, and then you can change it later. On the first 2 years, they have to have a supermajority. They have to have a 2/3 vote, which is very difficult to get. After 2 years, they can do it with a simple majority. So they could change it later on down the road, just as they can change everything later on down the road. But at least here in Washington State, we have the ability to pass things that they are, too scared to do. So I would say this bill is not the only bill. It's not the only way to solve things, but I'd say it's a definite step forward. Our initiative 1098. Peace, Health, and Death with Dignity bill. We have Washington State physician-assisted suicide now, and Peace Health being Catholic, I think the rationale is that it's connected with the Catholic Church. They say they do not have anything to do with that, so they don't allow any of their docs, and they're getting to be more and more of a monopoly in Whatcom County. I don't know how, practically speaking, if that's a large barrier, but it certainly is for all the people who see docs through Peace Health. In Oregon, where they had the first ever death with dignity bill, a lot of people who actually get their prescriptions for a lethal dose of medicine never end up actually using them. My sense is that if people really had good palliative care and guaranteed access to health coverage that they could rely on and not go bankrupt from, that would greatly lessen the desperation that drives people to need to do that. So I make a kind of a justice spin off the death with dignity bill, saying that if we all had, right to affordable health care that would actually cover everything, then I think it's still an important option for people to be able to, if they're having horrible suffering, to be able to end their life in a dignified manner. But I think that would take the pressure off it being such a financial hardship and for the families. And at 40,000, in fact, I was going to say if we can legalize marijuana and then we can put a tax on it, I would say, and the gentleman back there is collecting signatures, and I would support that. I think the number of people who would start smoking marijuana if we suddenly made it legal versus the incredible toll it takes on our tax system and the jails and law enforcement and everything else, that's a totally different issue, but I encourage you to see that gentleman at the back. Similarly, with these initiatives, I know a lot of us do it as a volunteer, and a lot of voters I've talked to say, oh, I'll sign if you're a volunteer, but I won't sign those paid signature gathering things. Myself, I've never met one of these people who don't believe in what they're doing, but not everyone in this economy can volunteer full-time. A lot of people have to actually, buy food and pay for their housing. So I hold nothing against people who are doing it unless they clearly, are doing it completely for the money. So I'd say support them too.
Okay, and then this is the last question.
Okay, last question. Let's see. A phrase, affordable health care options, is that different than coverage for all medically necessary care? Well, my understanding of the phrase affordable health care options is sort of like in Lewis Carroll. It can mean exactly what you want it to mean. It was really a spin message from insurance companies to call whatever they wanted it to be. For advocates like us, a lot of us try to avoid that term just for that reason, because it's so watered down. It can mean whatever someone wants it to mean. I would say the right to guaranteed health coverage is what we ought to make it.
Very good. So, right now we're going to, and thank you once again, Eileen and Jason and Dr. Covert-Bowlds. Take a very short break, be entertained by the Prawns one more time, and Donna Smith is going to set up, and then we'll be ready to go. Thank you.